Think your joint pain is harmless? The frightening truth is sometimes it's not just arthritis. It could be a warning sign of something far more serious happening inside your body. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in nonsurgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My mission is to help you live pain-free and optimize your health using treatments that are lower risk, evidence-based, and that actually target the root cause of your problem. Today's episode is Halloween themed, so it's fitting to shine a light on something scarier than ghosts or haunted houses. The frightening signs that your joint pain could mean something far more serious. Because sometimes those aches and pains and stiffness are not just arthritis, but red flags for deeper inflammation that can threaten your heart, lungs, blood vessels, and more. Most people assume joint pain is just part of aging or something that happens after too much activity. But there's a darker side of joint pain that many do not recognize. Some pain is mechanical, wear and tear on the joints, like a squeaky hinge. But some pain is inflammatory, and ignoring that pain is dangerous. Inflammation isn't just a local problem at the joint level. It's like a fire. If you don't put it out, it spreads, damaging organs far beyond where the pain started. In this video, I'll walk you through how to tell the difference between wear and tear pain and inflammatory pain, the frightening risks of leaving inflammatory pain untreated, how inflammation in your joints can be a red flag for heart, lung, and blood vessel problems, and the best ways to treat the root cause safely, without surgery or long-term tissue-damaging injections. So let's get started. When someone comes into my clinic with joint pain, the first questions I ask myself are, is this mechanical or is this inflammatory? Mechanical pain, like osteoarthritis, is wear and tear. Think of a door hinge that squeaks because it's worn down from use. It's about instability that progresses over time. Inflammatory pain is different. It's like lighting the whole door on fire. And if you don't stop the fire, it spreads. Here are key clues that your pain may be inflammatory. Morning stiffness that lasts longer than an hour. Swelling that feels warm or even hot to the touch. Pain that gets better with movement, but worse when you rest. Pain in the same joints on both sides of the body, like both wrists or both knees. Fatigue or flu-like symptoms that don't fit with simple arthritis. For example, one of my patients in her 40s thought she was just sore from working out, but her morning stiffness lasted hours and her wrist and elbow pains were actually swollen as well. She'd had these symptoms going on for months, not just after one workout. We diagnosed early rheumatoid arthritis after an evaluation. Because she came in early, we prevented long-term joint destruction. So the first frightening truth, not all joint pain is the same. Ignoring the difference can have serious consequences. Here's where things get more scary. Inflammatory arthritis isn't just about joints, it's systemic, meaning it affects your whole body. Let's talk about the monsters hiding behind inflammation. Number one, the heart. People with uncontrolled rheumatoid arthritis have nearly double the risk of heart attacks and strokes. That's because inflammation damages the lining of blood vessels, just like rust corroding your plumbing. Next, the lungs. Inflammation can scar lung tissue, leading to shortness of breath and chronic cough. This condition, called interstitial lung disease, is one of the most serious complications. Then there's the blood vessels. Sometimes inflammation attacks the vessels themselves. This is called vasculitis. It can cause skin rashes, nerve damage, even other organ failure. And then there are the eyes and skin. Eye inflammation can lead to vision problems, and conditions like psoriatic arthritis can cause painful rashes and skin changes as well. The scariest part, these complications don't always appear right away. Like a horror movie villain, inflammation often lurks in the shadows until damage is already done. Too many people delay care, thinking their pain will just fade away. But here's the truth. Inflammatory arthritis almost never disappears on its own. Think about it. You're talking about conditions where your immune system is being hyperreactive. It is very rare for the immune system, once it's been that fully activated, to just settle down on its own, especially if it's been ongoing for months, where there's no longer just one trigger, it's now just how the immune system is reacting overall. For example, I had a patient who ignored his swollen knuckles for a year. By the time she came in, her joints were already deformed and damaged. We couldn't reverse that damage. We could, however, put her existing inflammation into remission. But unfortunately, we could not undo the damage that was already there. Another patient example, a man in his early 50s. He brushed off his fatigue and sore shoulders as stress that he'd been dealing with for months. He, in fact, had uncontrolled inflammation that eventually contributed to actually a heart attack as well. Ignoring symptoms is like hearing creaks in your house at night. Sometimes it's nothing, but sometimes it's a warning that the foundation is crumbling. If you wait too long, the entire house can actually collapse. Here's the good news. The first line of defense is simple, safe, and powerful. Movement, low-impact exercise like walking, swimming, yoga, or cycling. Inflammation thrives in stagnation. Motion is lubrication for your joints. Diet. A Mediterranean-style diet, vegetables, fruit, beans, nuts, fish, olive oil, lean proteins, has strong evidence for lowering inflammation. Food can be fuel or it can be fire. Choose fuel. Supplements, omega-3, turmeric, vitamin D can help as well. They're not cures, but they can lower inflammation naturally. Stress and sleep. Chronic stress raises cortisol, which can fuel inflammation as well. Quality sleep is like your body's repair crew. It restores balance overnight. These sound simplistic, but there's elegance in simplicity. These habits are the garlic and wooden stakes that weaken the monster before it grows stronger. And of course, if these simple interventions are not cutting it, please see your doctor to get properly evaluated. For more aggressive systemic inflammation conditions like rheumatoid arthritis, psoriatic arthritis, or lupus, waiting is really not an option. These diseases can destroy joints and sometimes even organs fairly quickly if untreated. In these cases, early aggressive treatment is critical. It's the one time where waiting is the real horror story. In these cases, appropriate disease-modifying medications can stop the progress of disease, controlling inflammation to reduce pain, and even stop the inflammation throughout the body to prevent all the other damage that uncontrolled inflammation can cause. Let's clear up some myths. Myth number one, it's just aging. That's false. Even young adults and kids can develop inflammatory arthritis, and we treat them the same way we would any other adult who has these kind of autoimmune conditions. Myth number two, steroid injections are safe long-term. Again, false. A lot of people may get steroid injections for their inflammatory arthritis. That may be what's necessary short-term, but understand that if you get that too often, they can weaken tissue and accelerate the breakdown of tissue long-term. Myth number three, if I ignore it, it will go away. Of course, that's not true. It's false. Inflammatory arthritis almost always progresses if not addressed appropriately. These myths haunt patients, delaying care, and leading to damage that could have been prevented. As we wrap it up, let's use a Halloween-themed framework. Let's do the trick or treat framework here. Trick, ignoring your symptoms, chasing only short-term pain relief, or jumping straight to surgery. Treat, alternatively, listening to your body, starting with safe conservative measures, and working with an appropriate specialist for personalized care, and escalating to stronger treatments that treat the source of the problem if appropriate. Do not be tricked, choose a treat. Here's the bottom line. Joint pain may be common, but ignoring the wrong kind of pain is dangerous. The frightening part isn't the ache in your knees or the stiffness in your hands. It's a hidden inflammation that can damage your heart, lungs, blood vessels, and more. So this Halloween season, don't let the inflammatory monster sneak up on you. Pay attention to the warning signs, act early, and treat inflammation wisely. If you found this video helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. This is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. Thank you for watching. Have a safe Halloween. Take care of your health. And as always, live well.